So these are how we have organized our healthcare system. It does not come to this state within a short period. It's something built upon by successive health ministers. Starting, I remember as late back as Senior Minister Goh Chok Tong when he was my health minister. That was when we planned, put in Medisave, and then after that, Yeo Chow Tong, George Yeo, Lim Hng Kiang, and then I took over. So each generation built on what we inherited and make it better. I like to believe that our health system has further improved during the last 5 years, but I know there are still gaps and deficiencies. And we would work on them, we will fix those deficiencies. And in fact, fixing those deficiencies constitute my health manifesto. And my health manifesto, in turn, is one of the 6 thrusts of our PAP manifesto. Most of you would have received the PAP manifesto, and if you read page 10, one of the key thrusts, help our seniors stay active, healthy, and engaged. And what is our commitment? We honor our seniors. We will provide them the best possible support so that they can age with dignity and grace. And to achieve this, we listed or highlighted some of the key programs. This is a serious commitment. This is a promise that we are confident we will deliver. But we need your strong mandate for this health manifesto, as well as the other programs and trusts in the PAP manifesto. I know over the last few days there have been many proposals and suggestions by different parties about how they can improve our healthcare system. They say, throw away 3Ms. Instead, implement National Health Insurance Scheme. They said, like in many other countries. I know we have studied all those national health insurance schemes in US, Europe, Japan, Korea. There are big problems there. But when we design MediShield, MediShield is a national health insurance scheme, but with very big difference. It is specifically designed to avoid many of the pitfalls that other national health insurance schemes are experiencing. Economists call that moral hazards. These are abuses. Many years ago, when I was working under Senior Minister Goh Chok Tong, we described it as buffet lunch syndrome. Remember? Buffet lunch syndrome. You pay $10 or $20 for a buffet lunch, and then you eat as much as you can, or you take as much as you can. Better, the more expensive one, oysters, this and that, into your plate. But whether you finish it or not doesn't matter, because you already paid your $20. And then you try to wallop as much as you can. And this is precisely what happened to all this national health insurance scheme. Our MediShield is different. Our Medisave is different. In fact, as health minister the last 7 years, I have regular flow of visitors from different countries, from Europe, from China, from our regional neighbors, including from the US, senior economists who come here. They admire our system, but they also admit it, they cannot implement it because the politics there are completely different. It is not possible. Yeah. So they know that our system is the right thing, but they just cannot do it. Yeah. So we have a good functioning system. My advice is, I think, stick to it. We will further improve on it, but I think don't chuck it away. Certainly don't go and chuck it and adapt other systems which has already been creating new problems which are now cropping all over the place. I know another party, opposition party, also said, hospitals crowded, too few beds, build more hospitals. Yes, we are definitely building more hospitals. I announced that long ago. So, after Khoo Teck Puat, we are now building the hospitals in Jurong, and we will start planning another hospital in Sengkang, and we are building 3 new community hospitals. One in Yisun, one in Jurong, one in Sengkang. And we are building 2 new polyclinics. One in Yisun, one in Punggol. And we are upgrading quite a number of old polyclinics, because just like HUP, MUP for your housing estates, the polyclinics also need upgrading. And we are doing all those. So all these are real substantive programs with budget set aside. It will cost us billions of dollars, and we will deliver on the promise. It is easy for other politicians to just collect a list of wish lists and say, this is my health manifesto. Are they implementable? Is it viable? How are you going to finance them? I remember one suggestion about turning void decks into mini polyclinics. I agree with the objective. The objective is to bring subsidized outpatient care closer to the patients. That is a good objective. I agree with that. But I think our way of doing it is better. How? My way, our way, is PCPS, Primary Care Partnership Scheme. More than 700 GPs are our partners. So long as you are means tested, you are needy, and you need to see a doctor, if the GP is nearer to your house, instead of polyclinic, go to that GP. Every month, I will subsidize the patient to the GP. So the patient, you pay, the rates are similar to polyclinics. So you achieve that convenience, and you have GPs near to your place. Their solution of using void deck as mini polyclinics leads to a different question. Where are you going to get the doctors? Where are you going to get the nurses? My point is, the doctors and nurses are already there in the GPs, and we will build on that. As I said, in healthcare, I'm open to all ideas, all suggestions, wherever they come from. If they are good ideas, whether they come from opposition parties, if they are good ideas, if they will benefit Singaporeans, I'll be the first one to implement them. Or they can come from the media. In fact, I remember last month, Straits Times, there was a good article that says polyclinics are doing a very good job looking after the chronic sick. So they say, let's expand on that. Let's make our polyclinics centers of excellence in chronic care for diabetes, for stroke, for high blood pressure, and so on. And instead, rope in even more GPs to help out in those walk-in cough and colds and so on. Because right now, PCPS, we essentially look after the seniors, the elderly, who are low income. So the suggestion was, why can't we expand PCPS to also look after low income, even though they may not be old? So this is, I thought, is a sensible idea. We will take a look after GE to see how I can tweak the PCPS to allow this to happen. And there are many more things that we plan to do under our health manifesto. For example, I have done several rounds of MediSave, MediShield, ElderShield upgrade. My business is not finished yet. I still want to do many more upgradings of those schemes so that they can ease the financial burden on our patients, especially those born with congenital illnesses because they cannot get insurance, especially those who require nursing home care. I know nursing home care is not cheap. A good nursing home care without subsidy is about $1,500 at least per month. Right now, we have ElderShield. At first, when I inherited the scheme, it was only paying out about $300 a month. So 3 years ago, I upgraded it. So from $300, it's $400 per month. Instead of just paying for 5 years, it pays for 6 years. But I know that is still not enough. My own target is, I think we should try to bring $400 to $800 per month. Then at least half of the burden can be reduced. So this is another major idea which I would definitely try to implement during the next term of government. So all in all, I hope you appreciate that we have, as I said, a not bad healthcare system, but certainly there is scope to improve on it. If you ask me, can you improve? I say, yes, we certainly can. Are we complacent? I say, no. And I'm open. We have been adjusting and we will continue to make adjustments so that it works better for us. So the 3 M's, MediSave, MediShield, and MediFund, together, I think they can ensure that all Singaporeans, rich or poor, you can have good quality health care without worrying about your financial considerations. I know. Yeah. I know one big area which I also wanted to do is long-term care. I think by and large our hospitals now fairly high standard of care. There are problems here and there, service level, waiting time, which we will continue to tweak. But by and large, I think clinical standards is okay. But it is outside the hospital care where we are still not up to standard. And I wanted to fix that. And that's why at the last budget, remember budget 2011, Finance Ministry very generously set aside $1 billion Community Silver Trust Fund. The idea of this fund is to allow us to work together with good VWOs to transform the long-term care so that it can help our seniors to, as we said in this manifesto, age with dignity and with peace of mind. I think that can be done. We are confident that we can help bring that about. Yeah. So, in short, let me conclude. The last GE, thank you to all of you for giving my team a very strong mandate. We hope we have not disappointed you. We hope you have noticed the changes in Sembawang GRC, but there is still scope to do more, and we have specific plans in our local Sembawang manifesto to help transform Sembawang, particularly because for a long time development was held back because the fate of the Malayan Railway station is unclear. But now that it is clear, come July they will be moving their station from Tanjong Pagar to Woodlands. I think the uncertainties will disappear. It will allow us to do more longer-term planning. And also, as you know, both governments are discussing how to provide a fast rail link between Woodlands and JB. Now, whether that will take place is still subject to negotiations, but assuming that things proceed smoothly, I think we can look forward to greater development in the Woodlands area. Land is set aside for more commercial development. The pace, I cannot guarantee. It may take us 5 years to 10 years, so it may take more than one term, most likely 2 terms. But I think what we do over the next 5 years will tee up this development and help us achieve that vision, our collective vision of making the North, our GRC, an outstanding gateway to Singapore, something that we all living here can be very proud of.